Medicare plans, costs, and coverages. Age definitely has some benefits, especially when it comes to our topic today, Medicare. Today we'll be discussing the costs and benefits of different Medicare plans. There are 3 parts to Medicare that you're required to enroll in, and a 4th that is optional, but most people enroll in. The parts of Medicare are easy enough to remember, as they are Part A, B, C, and D. Parts A, B, and D are required, while Part C is optional. Medicare Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Medicare Part B covers certain doctor's services, outpatient care, medical supplies, and preventative services. Medicare Part D helps cover the cost of prescription drug coverages, including many recommended shots or vaccines. Medicare Part C, as mentioned, is optional. Sometimes referred to as a supplemental coverage, Part C is thought of as a choice between an HMO and a PPO coverage, like when you enroll for health insurance while working. You might think of Medicare Advantage plans under Part C as having coverage similar to an HMO, while Medigap coverage is more similar to a PPO. Okay, so now we know the 4 parts of Medicare. Let's turn to giving you an overview of the costs and benefits. Medicare Part A is usually free for most people after they are eligible. Eligibility is turning 65 or having a long-term disability and having worked for 10 years. If you or your spouse doesn't qualify based on a 10-year work requirement, then you'll pay a premium of $274 if you're single or $499 as a couple per month. The benefits of Part A allow for no copayment for the first 60 days in a hospital after your deductible of $1,556 has been reached. For stays between 61 and 150 days, you pay a pre-negotiated rate, while stays over 150 days are not covered. There are also benefits for skilled nursing care up to 100 days, and home health care and hospice. Part A is intended to get you into the hospital for acute and some short-term rehabilitation and back out within a relatively short period of time. Medicare Part B carries a premium of at least $170.10 per month for 2022 and will go higher as your income increases. This coverage generally covers outpatient and preventative cares, things like doctor's visits. You have a deductible of $233 before your co-insurance of 20% begins. There are many routine services that are covered at no cost, like certain lab services, home health care costs, mental health, etc. But generally, any services that aren't covered for free will be subject to that 20% co-insurance cost. Medicare Part D is prescription drug coverage and your last required part. These plans can vary wildly depending on the type of drugs you're taking and whether you're taking generics or formularies and where you live. Medicare Part C, otherwise known as Medicare Advantage or Medigap coverage, is varied, but generally speaking, the higher your benefits, the higher your monthly premiums will be. Medicare Advantage or Medigap allows you to customize your coverage and costs so that it fits within your specific needs. I recommend visiting the Medicare.gov website to search for plans in your area. In planning for retirement, it's important that you include the known costs of healthcare, like your Medicare premiums and out-of-pocket expenses, within your cash flow plan. But it doesn't end there. A well-planned retirement should also include a longer-term plan to spend more on health-related expenses throughout your life, as these expenses can become one of the largest draws on your financial resources.
Are you prepared for retirement? Schedule a free financial assessment with an experienced financial professional right online at purefinancial.com.